Thank you guys for coming to the low back pain seminar. Today we're going to talk about the common causes of low back pain. All right. Now I like to break this down into 3 different categories. We start first with joint, and then we'll talk about muscle and nerve. And when we have pain, it doesn't mean you only have one of these. Sometimes it's the case, and sometimes these will overlap. So we'll start with the common cause for joints. So we have a spine here. We're going to look at the spine, and we're going to look at the joints here. Now we have these guys here. They're called our facet joints. So they're throughout the spine all the way to the neck. And we also have discs. Now these discs are really thick. They resist a lot of load when we're moving. They're also another thing we like to classify as a joint because of the way the pain presents itself. So when we're looking at joint pain, we want to pay attention to the time of the day, right? Sometimes it's the morning, sometimes it's the afternoon. We want to pay attention to the symptoms. So sometimes it'll be really intense, sometimes it'll be mild. It'll jump side to side on the back. These are common things that I look at for that joint pain. There's really no simple movement that always aggravates it. It's pretty random, okay? Now when we talk about muscles, that's more of that ache type pain that you're gonna experience. Now with this one, it's pretty simple to find because it'll always be a similar activity. So for example, if we hurt our low back, right, and we know, okay, every time I twist right here, I get that achy, that pain right here. And then we know, okay, let's do it a couple times, see what that does, and you still have that pain, well then we know that muscle's affected, right? So if we look at the muscle chart here, we have a couple of players. We have our quadratus lumborum here, we have our rector spinae and our psoas major here, and our rector spinae they're deeper to this, but they kind of run up and down that spine. They're huge players in our low back when it comes to stability as we're picking things up. And as you go to pull, sometimes people lift with their backs and they'll do this, right? Or they're twisting as they pick something up and rotate. You're gonna have that sharp, quick jab at first, and then it becomes achy. And then no matter what you do, it doesn't go away. The pain kind of calms down every now and then, but then as soon as you go to use it, it's aggravating, right? So muscles, that's what we look for, is a certain movement that you're doing actively, whether that's picking up a weight, twisting, whatever, that's going to stimulate that pain every single time. Nerve. Nerve pain is a little different. We like to classify it as with a sharp, burning sensation, even tension. It can present itself as stiffness. Now with nerves, we're going to look at the where it comes out of the spine, right? As it goes down the spine, down the leg, and then as it gets down to the foot. And what we'll notice with this is, again, it'll limit certain range of motions. You'll get a tug, or you're going to sharp burn. It'll also bother you when you're doing activities, right? But when you're not on your feet, when you're not moving around, you're laying down, it's not going to be bothersome. Unless you push it enough to where it becomes inflamed. Now when it's inflamed, then you're going to have pain consistently until you bring the inflammation down. So, common causes, joint, the facet or the disc, that can be sharp, it can be on, it can be off, it can be over to the left, down the leg. It's very variable. Muscle, pretty consistent. Every time you use that muscle, you're going to feel it. Every time you don't use it, you're not going to feel it. Nerve, this one's kind of a blend where you're going to have a sharp burning pain. You're going to find that tension and hit it. And then as it inflames, it can be more consistent throughout the day or in the morning or at night. This one's a little harder to identify. So, those are the common causes. Now, things we like to do for these, for the joint, a common exercise we look at is what we call a Mackenzie press up. So for this, you're gonna lay on your stomach. And what we're doing is we're passively pushing into the ground, kind of like a cobra pose. And what we're doing is we're mobilizing those joints. Right, so we go down, do it again, and now we want to find a direction that these joints respond to. So what we should see is as you do that exercise, you're passively using those joints, and we should see a change in that pain, right? We should see it reduce. We should see it maybe climb on your leg and up to your hip. These are things that we can look at and load you and see, okay, is this joint related? One, if it is, great. Then we know, all right, let's see the response to the pain as you're doing those exercises. So that's a great way to address joint pain. And the next one will be muscle. Right? So we're talking about more strain here. So when we strain a muscle, we want to find a baseline. Right? So we want to find, okay, John, you can get away with picking up a 10-pound weight, right? You can do that, it hurts a little bit, but it's not too bad. Later that day, your back's not killing you, right? So when we talk about muscles or strains, we like to break it down into this little chart here to make sure we're staying in the boundaries of healthy healing, right? So I'm gonna draw you a little something here. This is too much. This is too little. So when we talk about strains or muscle pain for that low back, we have to find a baseline for you to start with for your exercises. That's not gonna make it angry at you, but also is pushing it enough to make it heal, right? So something that, say you're picking up, example, we did a 10-pound weight, but say it was really easy. Say John could pick it up, but yet it didn't bother him, he had no pain during. We look at that as he used that back a little bit, he used that muscle, no pain stimulated, no nothing after, totally fine, right? That's what we classify as too little. He didn't do enough for that muscle to heal. Say John does a 40-pound weight and he lifts it up and it hurts to do it, and then he puts it down, and then that night or that next morning, his back is killing him. He can barely move, it's really hurting, it's throbbing, it's aching. Well, he did too much, right? Too much weight, it tore those fibers more, it really irritated it, and now he's got a bunch of inflammation in there, and now we have to wait a couple days for that to settle down so we can load it again. So what we need to pay attention to is that middle zone, right? This is where we're gonna see most of the healing. It's right here, that middle zone, and what we'll see with this is, say you're instead of a 40-pound weight, John picks up a 25-pound weight. He picks it up, it hurts a little bit during, throughout the day it's a little achy. It's not, there's pain, but it's not terrible pain, right? That's when we know we're right, and we call the money zone, right? This is where we wanna be at to keep stimulating that muscle so it keeps healing, getting stronger. These are pretty typical where you're gonna be, you don't want to be any more than a 4 out of 10 on the pain. So a little less than that if you can, right there, that's okay. But any more than that, we run the risk of creating inflammation and then creating more pain. So what's crucial to this is we gotta constantly load it. And then, as the rehab progresses, you gotta be comfortable with it being consistently achy. That's okay, because as it gets stronger, it's gonna get better, right? Now what people get in trouble with this is, as they get stronger, this is gonna change, right? So say we start out, he's using a 25-pound weight to pick it up, right? We're doing rehab with that, and it's getting that 4 out of 10 pain, but then 2 weeks later, we're still using the 25-pound weight, but now he's adapted, he's got stronger, and that 25-pound weight is only going here, right? So now we gotta make the progression of, all right, well, let's try a 30-pound or 35-pound weight. And that's how we know that he's healing, and it's getting stronger, and then we'll get to a point to where we can really push this, and you're not gonna have that 4 out of 10 achy pain. It's not gonna be consistent, it's gonna really reduce, and you're gonna be able to do the activities that you wanna do. So that's where muscles are, they're a little tricky. They take longer to heal than the joints. The joints respond really fast to the exercise, or they don't. And that's how we can determine, are we going the right way, or, what do you have it. But muscles are a little longer. The rehab process is a little harder. There's no cut and dry spot for it. But it's doable. It does take some time and it takes some effort on you guys to work through it. Next thing that we have is nerve, right? We talk about nerve being one of those things where you get a lot of tension as you're doing something. So when you're sitting down, you feel a constant pull, right? Or even a sharp jab or a sharp shoot down the leg or a burden, right? Now nerves are tricky because we can definitely overdo it. So when we have a nerve that comes out of the spine here, right? And it goes down the leg. Now this nerve down the leg has to stretch and flex as we move our leg or as we move our body. What can happen is along the path of the muscles, we can get muscles that tack it down or entrap it. Kind of like if you were going fishing and you get a snag, that's what we're talking about. So as that nerve comes out and gets stuck in that muscle, every time I use my leg, that nerve can't stretch and it tugs and it causes pain, and causes pain, causes pain. And what happens is, as that happens, more inflammation can get created, and then that inflammation can turn into pain, and then we're stuck in this roller coaster, right? So what we look at is a nerve floss, or a nerve glide. Over here, nerve floss. Now we'll what this does is it helps get that nerve from being stuck and helps it mobilize, so then eventually it can start to flex and stretch like it needs to, and that pain will reduce. The tricky part of this is a couple of things. One, finding where that nerve entrapment is. Two, finding exercise that's going to hit that nerve entrapment. And then three, not overdoing it, right? So nerves do not like to be compressed, and they do not like to be stretched. What we're doing for the treatment is we have to stretch them. We're going to find, again, some of this tolerance that we do for the strains, but it's a lot less, right? So for these, usually we start with about 2 to 3 sets of 10 reps of whatever nerve floss. For example, a sciatic nerve floss that you can see that we do would be this, right? That's one. So as this leg straigens, it's tugging that nerve down, and as I bring my head back, it's giving it a little bit of slack. And I bring my head up, pull it, slack. So we would do 10 of these, all right? And then I will do 1 set. We can only do that 2 or 3 times a day because we can overdo it, or if we stretch it too much, then we'll get inflammation, then we'll be in some pain, and then we're going to have to reset a little bit, right? So we would start with a nerve floss there, but then also other things that we can do for that is if we find where the area of entrapment is, say it's up in the glute here, right? Then we can apply other treatments to that area as well. So we can do some dry needling, right? We can get in there and needle that glute to let it loosen up so that nerve can glide a little easier. We can do active release technique, that helps. Or we can do shockwave, and shockwave can get in there and help loosen up those fibers. And then again, making that nerve glide a lot easier and making that time a lot faster for you to get better. So that's what we look at for nerve, muscle, and joint. Those are pretty common causes that we see for that low back. The biggest thing is finding a clinician, right, that can take you through an assessment and try to break these out and see which one of these is affecting you. Or if you have a couple, right, you may have a joint and a muscle, right? Or you may have a muscle and a nerve. Or you may have a joint and a nerve, right? These are things that they overlap a lot, so we don't always just have one issue. But yeah, those are common causes. If you guys have any questions, feel free to ask me. Afterwards, we can talk about some exercises maybe that we look at that are kind of easy to do, or you know, things that you may be going through or you've gone through. We can talk about that too. But yeah, thank you guys for coming out on a Saturday. I know it's pretty nice out, so get out there and enjoy the day. Thanks, guys.